offers some of our medical classes at the high school, and this is Anitra Arnold, and she's also part of the nursing class.
Alright, so one of the main things is when you come to high school as a freshman, if you want to go into the medical field, you need to take health science. It's the first class that you take, and it's just the basic studies of health science education.
So like she said, you'll start off with your health science freshman year, but as you go on, you'll get to take more classes, more opportunities. So we have our medical therapeutic class that directly follows your health science class your sophomore year. You have rehab careers, your therapy classes, your physical therapy if you want to go into that. You have EMS, emergency services, diagnostic medicine. You have your anatomy and physiology, that's your science credit. And you have your nursing class if you're interested in that. Clinical internship, you get to explore different medical fields. And then you also have your dual medical terminology, and you'll get 3 college credits for that class.
If you want to go into any medical career, like so if you want to be a doctor, a physical therapist, an OT, a paramedic, pharmacist, vet, athletic trainer, anything that is medical related, you need to go into the health science education program.
I'm going to show you a short video that just shows all 3 teachers.
If you are interested in a high school career that has anything to do with the medical field, then health science is the place to be. You have so many options to choose from. There are 3 teachers here. I am Ginger McPherson, and I teach the nursing class, and I also teach a dual enrollment medical terminology, and I also have clinical internship. We go everywhere in the community. So you want to build and be able to take that your senior year. Now we go over to Miss Emerson, and she has anatomy and physiology, which everybody needs if they're going into any kind of science-related field. Plus, she teaches EMS. Those emergency medical professions are a must. Then we step over to Miss Coates. She has rehab therapy, and all you freshmen will take her your entrance into high school as your freshman year. She teaches health science education. Everybody has to take it if you're going to move up to the other ones. She also does rehab careers if you're interested in physical therapy or anything in the therapy field. So we have so much to offer in health science, and we're looking forward to you signing up for classes. If you have any questions, just find somebody and ask. Everybody would love to talk to you about what we offer at Chester County. Health science is the place to be. Be a hero, be a healthcare provider.
Okay, so lots of different things are offered and needed, and if you're going into health science, computer skills are a must. This is a group of students learning a computer system at a facility that they were at, this is a group of students learning vital signs. Even if you're with an athletic trainer doing a rotation, you go out onto the football field in an emergency situation, you still got to know if that patient and assess them very quickly. So pulse, respiration, blood pressure, all of those things are needed in almost every medical field that you go into. This is one of the students that is doing a rotation at a pharmacy. She's trying to decide whether she wants to go into pharmacy for a career. She did a 9-week rotation, and if you're in the clinical internship class, you have 3 rotations. You rotate to different areas in order to determine if that is something that you think you might be interested in. Plus, it gives you hands-on experience, and you get high school credit for not sitting in the classroom. So it's a great win for all. This is an athletic trainer, and she has a student with her. They're actually working at the football game. So as far as class, she does her class on Friday nights. She meets the athletic trainer. They wrap and tape pre-game. Then they take care of injuries during the game, and that is her rotation. She is getting valuable information while things are happening. This is another athletic training student that worked a basketball game, and he was instructed on how to do stretches in order to help this athlete out so he would not re-injure something that happened during one of the games. So they're given instructions, they get valuable information, and they're actually working hands-on. We also do a little bit of art and fun stuff in some of the classes, and this guy is doing a wound debridement. Now he mimics that by doing using tweezers and scissors and using an orange or a tangerine and peeling back dead skin, which is the little pulp on the outside. So they are debriding this, and it mimics like what they would do in physical therapy for wound debridement. This is another group of students that are using the spine board. You can see this blue board. They have her strapped down, and then they pick her up and move her. This would be for a patient who has a suspected neck or spinal injury. They are learning how to move the patient not to cause further injury. This group of students is demonstrating CPR, and over here, these students are showing them the dissection of the heart that they did in A&P. So there's lots of things going on in every class. We try to get you the most information that you would need during that class so you can carry on.
This is Miss Jessica Emerson's room. In her classroom, we have the back of an ambulance. And what it does is we can learn how to load a stretcher, unload the stretcher, and everything that is inside of it is what is in the back of the actual ambulance. So it's really cool. It's literally the same thing. So if you want to go into EMS or be a paramedic or anything, this is a good class to take, and it's really cool and really fun to join.
So during our time at the nursing class, we actually got to miss a few days of school and go over to the different schools. We came here a few days, middle school, the elementary schools, and we helped with the health screenings from Coordinated School Health.
We have a club at the high school. It is called HOSA. HOSA is one of the only clubs that you can join as a freshman. It's a really cool club to join. It stands for Health Occupational Students of America. You can do competitions, we have meetings, you can get service hours, service projects. It's really cool. This is one of the groups that went and competed. There's the regional level, state level, and national level. This is MRC. They went to their national level and they placed 6th out of 46 countries, I think, and it's just a bunch of stuff. So we were really proud about that. And I just did my regional competition. I placed 2nd. So here in a few weeks, I'll be going to Knoxville for 4 days out of school. And it's all paid for, and it's going to be really cool and really fun. So it's a good club to join.
And like she said, this was, they went to the international level, 47 states, several countries, Puerto Rico, China, American Samoa, lots of students, so thousands of students, and they placed 6th at the international level. So we were very proud of them. They went to the school board, and they were recognized there. So they're able to put all of that stuff on college applications, applications in high school for National Honor Society, for Tennessee Scholar, all those different things. You want to have all of this resume built up by the time you have to start applying for all this. It can start as early as a freshman. We also have HOSA Week. We had a blood drive. I will say that 89 units of blood were collected on the day that we had it, and our school is recognized as the largest in West Tennessee for getting pints of blood. So very proud of what Chester County High School has done. We also have HOSA Week and giveaways trying to promote HOSA. We had these bags that we gave away. We have HOSA shirts. Ice cream sundaes. We just have fun with each other of like people who want to go into the medical field. We have meetings. We have an activity period at the high school, and during activity period you will go to the club that you have joined, and that's where you get your agenda and know what's going on for the next amount of time before the next meeting. This is the group that went to the international HOSA and won and placed 6th. This is another couple of pictures of people who have competed over the past. And a lot of people get to their senior year and they say, I don't really want to do the medical field. That's okay. You've just saved your parents a whole lot of money. But what if you decide to stick with it? Look at all the valuable information that you've learned to carry with you to your next few classes. We take field trips. One of them that we took last year was going to Jackson State Community College. They have a $7 million allied health building. It has respiratory, nursing, occupational therapy, physical therapy, x-ray, medical lab, any health care that you could imagine. And with the Tennessee Promise now that pays for 2 full years, you can graduate with one of these programs and be debt-free and start working. So it's another thing to consider. You don't have to go to a long college. You can get these programs in a 2-year. You can even go to TCAT and do a 15-month program there and start to work 15 months after graduation in very, very good and high-paying jobs. We also take a trip for fun. We have a fundraiser, and if you participate in that, then we took all of those that sold, and we went to the zoo. They were able to talk to the zookeepers and some of the people there for health fields as far as veterinarian. They had a really good time, enjoyed that a lot. So we try to do fun stuff too. And then we get back to giving back to the community, our service projects. So emergency preparedness, we do that all year long. It's one of the competition that those 4 girls that you saw on that screen did. Collecting socks for the homeless, canned food drive for the community, volunteering at lots of different places, collecting dog and cat food because, like I said, one of our partners is Chester County Animal Hospital. So it's not only humans that we're dealing with. If you're interested in veterinary medicine, we do partner with them, and I have a student that is there working on a rotation right now. And then, of course, the blood drives, and as a senior, you can earn a red cord for participating in that program as well to wear at graduation, red cord. We're preparing you for the future, trying to get you some industry certs. CPR for BLS, it's the same course that the doctors take. Every doctor, every nurse takes the same course. You get a certification for that. We do an OSHA 10 for safety and healthcare. We have certified nursing assistant. A new one that we're adding this year is patient care technician. So if you're going off to school somewhere, you can walk in a hospital, they will hire you in a minute. And you can work there and gain valuable experience while you're going to college. We have dual enrollment medical terminology that's going to give you 3 credit hours for college. And if your program doesn't require it, it's still elective. And then, of course, this year we started something new with TCAT. We're doing a dual enrollment health informatics, and that's about coding and billing. So if you don't want to deal with patients but still want to make a good salary and not deal with the blood and guts, then that TCAT health informatics would be a route to go. Remember, health science is the class that you register for as a 9th grader. There's not really any other choice because you have to take that entry level. So that's what health science is in a nutshell. Is there anybody that has any questions? Anybody? Questions on health science or what you need to do? Okay, does anybody want to try to experience CPR? Let me tell you how we're going to do this. One at a time, you're going to come up. This band you will put on your arm. It will start out red, and if you're doing it the correct way, it will turn green. On this mannequin that you're going to be doing the chest compressions, and these students are going to instruct you on how to do that, there'll be 2 green dots that light up if you're doing it correctly. If you get red or yellow, then you're not doing it correctly, and they'll tell you how to make sure that you do it right. So you want 2 green dots on the mannequin, and you want green dots on the wristband. So whoever tries it, that's what, okay, come on up. Just put this on your wrist, and they'll tell you what to do.
Okay, so you'll kneel down on the red one. And you'll make sure you're facing this way, turning that the other way. Yep. And then interlace your fingers. Alright, and then you'll go directly right there. Yep. And you'll push hard down. Make sure you go all the way.
Not fast enough.
A little faster. Make sure you have your fingers. There you go.
Make sure you go all the way down so you can inflate the heart.
Don't come up. Don't come off the stand.
1, 2, 3.
Go hard.